Good morning, good afternoon, good evening. Live from Toronto, this is IFA's Global Café. My name is Bruna Suertes. I'm Director of Communications at IFA, and it is my pleasure to host today's session. This session is being recorded. It's also being live streamed through our Facebook channel, and we encourage your participation through the chat box. If you want to post any comment or question, please feel free to type them in the chat function on the bottom of your screen. We have an amazing session today, and I'll hand it over to Dr. Jane Barrett to start it. Jane, the floor is yours.
And thank you very much, Bruna, and welcome one and all. I know today that many of us are at different events because this is really the beginning of celebrating the International Day of Older Persons. So we acknowledge all of those competing events going on around us. You know, our global cafes have really been a journey for many of us. We started these global cafes as a way of being connected during COVID. And now we move into a different phase where we're really going to be in conversation with some inspirational thought leaders around the world. So not only will we hear about their work and their vision for improving the lives of older people, but we'll hear a little bit about them as individuals and really what drives them to be who they are in our world today. Some years ago, it must be about 15 now, I had the great pleasure of being introduced, Greg and I, to introduce to Dr. Hisashi Hazumi. Dr. Hazumi is one of those people who just gifts wisdom, inspiration, thoughtful approaches about the care of older people, not only in Japan, but globally. He also brings to, every conversation, this generosity of spirit, generosity of sharing ideas, but also an out-of-the-box thinking about everybody and what they deserve in life. And so part of our conversation today will be focusing on the vision and inspiration of Dr. Hisashi Hazumi. And that leads me to introduce who I'm going to be talking to today, and that's Ayuk Christian. Ayuk Christian, Ayuk, you've been in our lives for just as many years, and I want to really firstly start off by asking you, tell me a little bit about yourself, because it always struck me, you're working in Japan, you're from Cameroon. What's been your journey to get you to the place of today? So where did you grow up, for example?
Thank you very much, Jane. And first, I would like to thank the IFA for this opportunity to be part of this very important event, the Global Café. I'd like to thank the staff, Bruna. I would like to thank Luanga. Okay. I would like to thank Greg, and I especially would like to thank these preparations that I've received over the past few days. I mean, I feel like, well, this is something I can do and enjoy, and hopefully our participants will enjoy this particular session. Oh, about myself, Jane, it's going to take a few days for me to finish the story, but let me just go this way. I am a Cameroonian, as I just said. I come from a very big family, large family of 19 brothers and sisters. I'm one of the 19 children. My father was married to 3 wives, and we all lived in the same house. It was not like we were separate, living separately or anything like that. So we come from the English-speaking region of Cameroon. So, but, well, we went to school, and in school, they always taught us English and French. Now, my move to Japan was kind of very lucky. I can say a lucky day, a lucky moment, because I just got this information about an international exchange program, which is organized and sponsored by the Japanese government. I was selected as one of the 10 participants. I visited Japan in 2002, my first time to visit Japan. That's where I met my wife, and then we just friends because we're together in the program. And in my next visit to Japan, I was homestaying at her family home here in Akita. Then we kind of like developed a very stronger, relationship, and we got married a few years later. And fortunately for me, I just got a lot of connections, as her family really has some strong ties with prominent people in the city. And the mayor is one of them. The current mayor, Motomo, is one of them. And when I expressed my interest in looking for a job in Akita, he called his older brother, who is Dr. Hozumi, my current boss. And I went for the interview, and bam, he said, "You're hired," just like that.
So Ayuk, you did travel around a lot,
Yeah.
because I understand that your father worked in customs. Is that right?
Yes, customs officer. That's right.
Yeah.
Yes. So yeah, he was transferred almost every year. He had to move from one town or city to another, and sometimes he will leave us. He will leave us in a family home, and because of the distance and the burden of transferring so many children and load of property. So, well, that was a bit difficult for us because we couldn't stay with our friends where we developed friendship with our neighbors or schoolmates. We couldn't stay with them for a very long time. We had to move. But it was a good experience because we moved from the English region, sometimes cities in the French region, and it helped polish our French skills a little bit. French language skills a little bit.
So Dr. Hisashi Hozumi, you came to work for him.
Yeah.
So just talk with us a little bit about Dr. Hozumi, because really you're representing him on this global cafe. And I do hope, Dr. Hozumi, if you're not with us, for the real time, that you'll watch it afterwards. So, tell us a little bit about Dr. Hozumi.
Well, it's really difficult to put it in very short sentences or in a very short story, because this is a wonderful man. He is very simple. And let me just give you an image. Dr. Hozumi, when we sit together, it's not like a boss and employee. No. He is talking to me as a friend. And he is very humble, which is common among the Japanese people. He is very respectful. He is extremely generous. And he has always told me, Ayuk, if you want to do something, you do it. Don't overthink it. If you have the means and the will to do it, go ahead. That's when, we talked about the international forum in Akita City. Then he moved on. We talked about the international workshop in Cameroon. And that's how he does things. I was just really amazed at the speed at which he comes up with great ideas. He is a visionary. And well, when I come like, he said, I come like an employee, meeting the boss. He says, relax, just say what's, and his door is always open for me to come and meet him and talk whatever I want to say and whatever is on my mind.
Yes, look, and Dr. Hozumi has certainly a footprint in the world of aged care, not only in Akita, but around the world. And there's something very unique about the way Dr. Hozumi views the environment. And we talk a lot about this when we talk about the decade, don't we? You know, and the stock standard phrase is, how do we create an environment that enables an older person to do what they have reason to value? And on that premise, Dr. Hozumi has a vision, and it really is, using art as a medium for happiness, because he has a true belief that one of his purposes is to create that environment for happiness.
That's true. That's very true, Jane. And if I may just go to present a brief background of how all this started. Dr. Hozomi's father, late father, he was an art collector. I mean, his father started with collecting antiques. So then Dr. Hozomi was just graduated from a medical university here in Akita and joined his father to run the hospital. And a few years later, he was made a director of the hospital, Dr. Hozomi, I'm talking about. And then he said, oh, I would like to continue the legacy of my father. I would like to, keep these artworks and see how to use them for the benefit of the patients or residents in the care facilities and the staff or the community or the city as a whole. So it all started with him visiting the Westminster Hospital in London. And here he observed that the hospital was unlike any other as it stands out and blends in the street. It was not like a hospital where it is separated from, from busy areas. And he said he could easily have mistaken the hospital for a shopping mall or a beauty salon or, any other commercial facility. So that's where he really thought about bringing that idea to his company here in Akita.
So let's just have a discussion about a number of different facilities that that Dr. Hozomi has built. And the first one is the Soto Asahirakawa Hospital.
Yeah.
So this is one of the hospitals that Dr. Hozomi, owns and manages. So it gives us a sense of, the value of art within this environment. Now, this is a general hospital. And so, there are, people who are in a very acute state, of health and well-being, all the way up to, those that are in for daycare. So it looks a very ordinary hospital from the outside. And I've had the pleasure of going there. But as you walk through the door, something really manifests around you.
Yes, it is. It is, Jane. This is a hospital and the only hospital in the prefecture or region or state or province, I can say, that has a hospice ward. So this is the inside, these are the public areas of the hospital. Yes.
So in terms of, the areas and the murals, can you talk with us a little bit about, the artists that Dr. Hozomi, commissions to come in and paint these murals?
Yes, of course. These are really great works of art, and I know one of the artists is Joseph Boyce, and Dr. Hozomi is very, very fond of the artist. And well, these arts that you see on the walls were not there at when this hospital was constructed. So when the idea came on in 1999, it was called the Hospice Art Project. So these areas that you see, except for the main entrance and lobby, the other two pictures are in the hospice section of the hospital. And the artist was invited not just to put those paintings or those artworks on the wall, but to try and collaborate with the patients, some of whom are interested in art. And together, they could come up with an artwork like this.
What was really fascinating to me is that, Dr. Hozomi has his $1 million art collection sitting on the walls of a public hospital. Because he truly believes that everybody should enjoy, the inspiration of others. So, and that seems to be, a continuing story with Dr. Hazumi.
Mm.
And that's not only on the main floor, but it's
Mm.
on various floors of the hospital.
Yes.
And I think that he does have one of the largest collections of Boise, is that correct?
Yes. Boys, yes.
Yeah,
Boys,
in the world.
Yeah.
And so I think probably some of the art collection is sitting on the walls in this hospital.
Yes.
I now want to turn to aged care facilities.
Okay.
There's often a lot of discussion around, not only the built infrastructure, but the care ratio of staff to residents. And Dr. Hazumi has been very particular, in creating an environment for people that may be in a facility for only a short time or for a very long time. And I've also had the pleasure of being part of, going to these facilities. So let's have a look at two nursing homes. One is called Sophie and the other is called the Nursing Home Green.
Yeah.
So once again, 50 senior residents live here. It's assisted living, paid nursing. But you walk through the entrance, Ayuk, and there's something that happens to the way that you feel about life in general. So let's have a look at this next image. So, so the mural by Richard Long, Akita waterfall line. Now that was particularly commissioned, wasn't it, for this facility?
Yes, it was. And Jane, this facility was opened in 2003.
Yes.
And yes, when it was constructed, this particular wall was reserved for something like this, an artwork. And Dr. Hazumi, he has met Richard Long, maybe somewhere in Europe or in another country during one of his visits to museums. And then he thought of what could really be a good and appropriate artwork in a nursing facility. So he spoke with the art consultant, the Medical Corporation, Junkekai art consultant, that he is working with Mr. Kato, and they thought of requesting Mr. Long to come and present or to come and do the art, to come and do art on that wall. So this art that you see is called the Akita waterfall line. And why is it so? Because it is an inspiration of Mr. Long's travels in Akita City. He visited a mountain called the Mount Chokai. It is one of the most beautiful mountains in Japan. It's just like the Mount Fuji. So his idea was to travel, to walk around, to explore the city and see what can really inspire him to create an artwork in a nursing home. So in July 2003, that's when Mr. Long started this art. He used mud, water, and paint. And he used his hands to splash the mud on the wall. So the size of this art, of this wall, the mural that you see, is 15 meters in width and 7 meters in height. So when you get into the building, that's the first thing that welcomes you and you say, what is this? So I can say the artwork is very unique in Akita or anywhere else because the water is from Akita, the water used is from Akita, the soil is from Akita. So, and the artwork was created there in that facility. It wasn't taken from somewhere and transported to Akita. So that is a special meaning to this particular artwork that you see.
Just pausing there, you said something that I think I want to highlight. And you said that the art consultant for Medical Junkai Kai. Now, I don't know too many medical facilities that have art consultants. And I think that's a very unique. I mean, Dr. Hazumi really wants the very best you know, for the facilities so that people who live in them can really feel as though that their life is worth something at every moment of their journey, you know, from the beginning all the way through to the end. I'd like us to put that slide back up because, you know, I'm always just excited when I see the giant pumpkin art by Kusami Yayoi. So could you please speak to a little bit about that? Because I know that Dr. Hazumi and Kusami, you know, have a strong relationship. Can you talk about that a little bit?
Yes, of course, Jane, I can talk about this pumpkin, but I think I would prefer, and it will make more sense if I talk about the bigger pumpkin, which is on the roof of the outpatient clinic, because this one is smaller. This one is smaller and came after that bigger pumpkin.
All right, so let's move on to looking at the nursing home green first, and then we'll move on to the bigger pumpkin on the roof.
Yeah.
You know, all the way through this, what we're talking about is art as a medium for happiness. And also the leadership and inspiration of Dr. Hazumi in ensuring that, you know, this art is symbolic of, you know, the facilities that he has developed and run. So perhaps we could have, you know, thank you very much. So this is 2010. What also fascinating, Ayuk, is 2003. So that's nearly 20 years ago, you know, Dr. Hazumi felt the importance of art. So I think that's a really, you know, it's way before, you know, his time. So nursing home green is long-term care and also assisted living. So, you know, this is a later, more modern facility, but what happens inside of it is also of great importance. So, Ayuk, this is one of the later facilities, and once again, I've had the pleasure of being part of that. So, talk with us about the built-in art and the art exhibition in the hallway.
Okay, Jane, like Sophie, like nursing home Sophie, green is also one of the facilities that serve as a museum in the local community. Because let me just go back a little bit by saying that Dr. Hazumi came up with, and Dr. Hazumi together with the art consultant came up with an idea that how do you bring people into a care facilities like this? How do you encourage people or relatives to visit their relatives in a care facility? How do you create an environment where the staff can improve on their performance? And how do you contribute to the development of the local community? So the designs here were already thought of before this facility was built, and in consultation with great artists, most of whom are Japanese. Dr. Hazumi think that they should use the natural environment, green as the name implies, the natural environment of Akita City. And that's why you see most of the art here, well, we can't really see what's on the wall in the picture on the left, but you see above the picture on the right, you see a pillar.
Yes.
And between is carved a green sculpture or something there. If you look at it closer, you really enjoy the detail on how the sculpture was made. And this is in a public space, of course, where, well, a visitor or a relative can go and say, oh, what is this? There, it kicks off conversation, maybe with the staff or with another resident.
So, you know, you use the word art museum.
Yes.
And I think that's a critical word too. So not only do you have an environment that creates, you know, positive energy and happiness, but also, you know, Dr. Hazumi is encouraging the general public to come in and visit these facilities, you know, and they may or may not have loved ones in the facility, but to see the art and see this as a forum. And I think that's a very unique idea also, wouldn't you think?
Yes, of course, Jane. And let me just go further to explain that these facilities are just part of the art project. The company was also running a museum of contemporary art, which was located in a hotel building. So, yes, it's called the With You Group Museum of Contemporary Art. We visited the other one in Kyoto.
Yes, yes.
So when visitors go to the museum to look at artwork, they are being informed that, well, you can also visit the facilities, the care facilities, nursing home, Green or nursing home, Sophie. And some of them do actually visit those facilities. Well, there is a controlled way of, allowing people in a care facility like that, of course. So it was really successful. It is, well, with Corona, the COVID-19, it's not happening now. Exhibitions are not happening now, but often in a year, about 2 or 3 times, the artworks, the pictures, photos, and artworks that are movable can be changed from time to time, so as to encourage people to come and see what is being exhibited at the time.
Look, thank you for that. The last set of images that we're going to see are from a clinic, the Soto Asahikawa Satellite Clinic. And this is memorable, I can tell you. So let's have a look at, how Dr. Hazumi and his art critics have encouraged, a livable situation where this is a satellite clinic. It's got outpatients, it's got dentistry, it's got podiatry. It's so let's have a look at this. Now, this clinic, when was it open?
The clinic was opened in 2010.
Okay, but in terms of the clinic, is that a public clinic, Ayuk?
It is a private clinic.
Yep.
It's a private run clinic. And the clinic has a dermatology department, of course, and a diagnosis and treatment department, and a dentistry. Yeah.
All right, beautiful. So tell us the story about this big pumpkin that's on the roof and how the pumpkin travels around the world sometimes.
Oh, yeah. So this pumpkin, is the artwork of Yayoi Kusama, who is a well-renowned Japanese artist. And this pumpkin has really moved from this hospital, not originally on the roof of this clinic. It moved from Tokyo and came to Akita and was placed near Akita train station, central train station, so that people could come and look at it. And it was there for a while. And then this clinic was constructed and it moved onto the roof of this clinic for good reasons, of course. I will explain that later. And the pumpkin has again moved from Akita City to Kyoto for exhibition, and then back to Akita City. So the pumpkin is already part of the building design.
Yes.
It's part of the building design. That's the whole idea.
Interesting. So let's go on to look at another couple of images from inside the clinic. So, the artworks of Yayoi Kusama really feature very prominently, in Dr. Hazumi's art collection. And I think she's in her mid-80s now, but I know that Dr. Hazumi and also Yayoi Kusama, have met many times.
Yeah.
So let's see if we can get the images of inside the clinic up. So once again, Ayuk, talk with us about these images.
Okay. Now on the left is the works of Sama Yayoi, and you can see there is still a pumpkin similar to the one on the roof outside. And well, Kusama Yayoi's idea, philosophy is about infinity. infinity, continue, nothing should die. And Dr. Hozumi picked up on that and said, well, what can really last forever? You know, when people look at this, they want to enjoy life for as long as it is possible. When people look at how it works, they want to get some kind of calm feeling. You take their mind off whatever problem they are having or whatever treatment they are going to have in the clinic. So borrowing from that, he has a large collection. Dr. Hozumi, I'm talking about, has a large collection of Kusama Yayo's artwork.
Okay, so
And,
talk with me about this mural, Ayuk.
Okay, the mural there is of Mount Taihezan. Now, Mount Taihezan is located just across from the clinic. You can see it from outside the clinic. Yes, you can see the mountain from some days. It's really beautiful. Yeah. So the artist is Satoshi Watanabe. He is a Japanese and a great contemporary artist. Yes. So using a picture of that mountain, he created this mural.
Right. Yeah. Extraordinary. Yeah. And then, of course, we've got another art exhibition in the hallway of this outpatient clinic.
Yes. And you can see Kusama Yayo's pumpkin, which is the same.
Yes.
Yeah, on the right. Yes.
Right.
Yeah.
Okay. So let's go on to the last image, and then we'll open it up to the floor. And this is the arc wall design on the dentistry. And we've got a view from the outside as well as a view from the inside, which is extraordinary. I wouldn't mind going to the dentist if I had to look at this. So this is absolutely what it looks like, isn't it, Ayuk?
It is, Jane. And well, my office is in this clinic, and most of the time, or some of the times that I go to do whatever with my colleagues in the dentistry to talk about something, I just push myself over to this area to get a few minutes and just look at this and say, oh, I'm glad I'm here. It's just that feeling that you have. And these, when you're in the dentistry, I mean, you don't really care about what the dentist is doing, is giving you whatever is working on your body or teeth. You're just so amazed and thinking, oh, I'm in a calm and serene place. So this takes your mind off those, maybe toothache, or takes your mind off the procedure, whether it's 2 hours, 3 hours, you say, well, I'm in a good place. That's the kind of feeling you get.
Yes, look, thank you for that. We can take that slide down, and I just want to talk a little bit about age-friendly Akita.
Yeah.
Because Dr. Hozumi founded Friends of IFA in the city of Akita, in the Akita prefecture, but then really worked extremely hard, with Mayor Hozumi, his brother, to ensure that the city of Akita became part of the global network of age-friendly cities and communities. Could you talk a little bit about that to us?
Yes, and well, Jane, I mean, much of the times it will go to the IFA, for the forum, the International Forum on Aging in Place and Age-Friendly Cities that we had in 2009, because that brought in the Mayor Motomo, with his staff, of course, to get a sense of the happenings, things that are happening around the world as far as aging is concerned. And again, he sent a representative to Dublin.
Yes.
When they were at the conference, or Age-Friendly Cities Conference in Dublin. And coming back, the city just kicked off with this age-friendly, because already the city has or is working on the barrier-free concept and the universal design concept.
Yes.
So putting this together, they say, oh, we can just improve some things here and there and adopt the WHO concept of age-friendly cities. And passionately, the mayor did so, and over the years, and is still very passionate about the age-friendly work. here in Akita City. Yeah.
And it certainly extended to buildings that were going to be developed, in the centre of the city and ensuring accessible design. But I was also fascinated when I was there about, and, the city asked us to do an assessment of the heated footpaths.
That's right.
So talk with us about these heated footpaths, because I think Toronto needs them badly. So tell us about that.
Yes, and Jane, every day since for over many years that I've been in Akita, when I drive around, I see there are constructions of footpaths, of these heated footpaths, because you will see that opening and you will see, I don't know, lead pipes or whatever they use there. Yes. I can't go closer because it's blocked. The area is always blocked. I tried taking pictures. Sometimes I couldn't, but the city, of course, is planning to increase the number of these footpaths. For now, their focus is in areas with heavy foot traffic. Yes. For example, school zones and around administrative buildings and around shopping malls. Yes. It is a wonderful, wonderful project. And hopefully Toronto, Canada will adopt this this idea.
Yeah, wouldn't that be good? Ayuk, I'm going to ask a question on behalf of Shmuel, and he really wanted to talk with you about art, a medium. Is it a good tool for treatment in terms of mental health problems? Now, we can't talk from a scientific perspective, but you might have some reflections of what Dr. Hazumi would have asked you about.
Yes, of course. And that is a very good question, because when we talk about arts improving the mental well-being of somebody, I will give you an example. The company Medical Corporation Junkekai has a group home. This group home, the residents there have advanced stages of dementia.
Yes.
And so this group home is one of the facilities with art displays, and it's inside it also has an art, an old wall taken from a village and transferred to that facilities and placed in there so that the residents can feel like they're in their own community, they're in their own neighborhood. And before this art project was introduced to that facility, most of the residents will kind of stay in their room. They don't come out, they don't talk to each other. But when this art was introduced, many of them and most of them will spend most of their time in the day in that public area where they talk about the world and reflect on their own lives when they were young and when things were simple and they had buildings just like this.
I also remember, and that this may be the same facility, where there's gardens within the facility. I can recall that there was a Japanese garden in one of the facilities, which was in the facility versus outside. And I felt that that was a really important focal point.
Well, not actually a garden, Jane. It was kind of like a design. Yes. A design, yes, with changing numbers. You can see numbers changing on the floor, and you can sit in that area. You can eat, or there's a table there also. Yeah,
that's right. Yes, it's the changing numbers. David Richardson, did you want to come forward and ask a question about the consultation with patients and residents?
Yes, I'm just interested. It's been mentioned a couple of times that patients and or residents of facilities were consulted with respect to the art installations and so on, and that's intriguing to me. And I wonder if our speaker could elaborate on that, how the consultations were done, what sorts of things were asked of them, etc. Thank you.
Thank you, David.
Okay, great. Thank you, David. That's a very interesting question. Thank you for asking that. And I talked about the Sota Saikawa Hospital and the hospice ward. And when this art project started, when it really started in 1999, Dr. Hazumi and the art consultant group, they invited an artist to come in and talk about how they can help the patients, those who are in the terminally ill patients, those who can contribute to creating an artwork. There was one patient there who was also an artist in his younger days. And when this artist invited from outside, talked with this patient, and he was intrigued by how the patients could, come up with an idea so fast and so soon, and they developed a relationship with the artist and the patient, and together over a few months before, unfortunately, the patient passed away, they created an artwork. That's where this project started. And then it was just at the experimental stage, sorry.
Okay. Look, thank you for that. And I think it's really important how we engage with one another, we relate. There's a lot of comments in the chat box, so thank you very much. A comment and a question from Alexandra speaks to, the inspiration of art and the values, but a little bit concerned about, public sector funding cannot afford works of art by famous artists. Would you like to just make a comment about that?
Yes, of course, Jane. I would very, very much like to talk about that. And I spoke with Dr. Hozomi, of course. What I'm saying here, I've really had several conversations, and I understand his vision, and I understand many of the things that he has done and plan to do. Now, when you talk about money, it is not always easy, to sponsor an art project such as this. But if the community or the city can create a project that could encourage upcoming artists to display their work somewhere, to display their artwork somewhere, I think that would be a good start for something like this. You don't need money. It's a volunteer. You invite upcoming artists as volunteers. Do you have something you like to show people? Do you have something you like people to see? That could help. I mean, you don't need to look for big funding for that.
Yeah, I just want to call on Bill Smith to make his comment. Bill, it's a perfect comment.
I believe, first of all, it gives me great pleasure to have a memory of my wife who passed away. About 30 years ago, she was involved with a graduate program and learned how to write a grant. And she was able to prepare this grant with the guidance of a professor that later was used to fund a Cabrini gallery, which was a wall in the administrative areas and a walking area on the first floor that local artists could display their work. And they juried 3 shows a year so that the artwork was present there. And the Westchester Council for Council of Art actually juried the work, because many artists in the river towns in Westchester County are prolific in what they have, but it's stored in their closets because they just have no place to display it. So when we get long-term care facilities or hospitals, it's a great opportunity to display that work. Thank you.
Yeah, Anne was a woman of many talents, Bill. Grant writing is another one. Brenda Sherlock, would you like to come forward and just share your perspectives about this lost horizon?
I'm just wondering, for some people, they never see the horizon. And just this morning, I was outside and I heard a buzzard after a poor unfortunate underboard. So it's amazing how many people never actually look at the sky. And if you were in a facility, look at all the different facilities. You go into one place and it's dark and dreary. It is not welcoming. And that I would see as the difference in an art form. If you saw something that uplifted your spirit, for want of a better word.
What a great image, the uplifting of spirit. We have a comment from Wench. Wench is in Turkey on sabbatical. And so Ayuk, perhaps Wench can connect with you to visit, the city of Akita.
Absolutely. We'll be very, very glad to welcome you, of course.
Yeah. Anna
Yeah.
Maria, you've made a couple of comments about, research in geriatrics continuing to point to the importance of art in reducing anxiety and depression. Would you like to make a comment about that?
Oh, thank you, Dr. Barrett. Yes, I work with seniors here in Ottawa as a volunteer,
Yes.
and also study creative art as a form of therapy. And since the pandemic, I start to work with first with mandalas and then with creative art with seniors. And I do a lot of research on the importance of art in happy aging, for the older population. And currently I encouraging more members of the Cultural Seniors Coalition, 25 Cultural Seniors Organization, to apply for the city, because the city has art programs, and to explore art. And in my first session, I saw an absolute change of one particular senior, which she was so recluse. And finally, I convinced her to come outdoors for the painting art start with a watercolor pencil. And I saw her transformation. And the third time at 6:30 in the morning, she called me. It was time for her to be in the lobby for me to pick her up. And I see how art encourage seniors to do something different and engage. And when they go out, for example, there is one senior that pick up flowers and leaves and do art by himself. Art also encourage hand mobility, and it calms you for anxiety and depression. It's very helpful. And I read a lot, and I see that it's speaking more and more that the art is very important for the well-being of the individual of any age, but in particular for seniors that are so reclusive.
Thank you very much for that. I appreciate your sentiments. And David, yes, the images can be made available from the presentation. Ayuk, I think Dr. Huzumi would be very pleased and proud for these to be available.
Yes, of course. And Jane, I just want to go back to Brendan and thank you so much for those comments. Just to add to Brendan's comments and to say that, people do visit hospitals when they're sick or ill or worried about something about their health. But most people do not go to art galleries. Why? Because they think it is to go to an art gallery is too elitist, too exclusive and intimidating. So for when you create this kind of idea, which is obviously free, they don't charge fees for people to visit these facilities, it kind of like encourages people to say, oh, well, this is something that's coming to me. I'm not going to it. So the facility is in their communities. You can walk in and talk to residents about an artwork or talk to a staff about an artwork. So creating opportunities sometimes is really good.
Look, thank you very much. And I just want to acknowledge the many people have put notes in the chat box. Bridget, who talked about also moving around, at an early age, and Alexandra, who talked about dance. As we start wrapping up the session, Ayuk, I'm going to introduce the speaker for next week, and then I'm going to come back to you and ask you for some key takeaway messages.
Okay.
So, as you can see, there's a slightly different format in our global cafes going forward, because we really do want to hear from the person and the area that inspires them or that they work in. So I've got great pleasure in letting you all know that next week we'll be in conversation with Colm Lowe. And Colm is the director of the Design Aging Institute in the United Kingdom. And the Design Aging Institute has only been established over the last 2 years. It's part of the Royal Helen Hamlin Institute, and he has a lot to say. And I think just in the earlier conversation, I said to him, and who are you? What do you do? And he said, I shout a lot. He said, we've got enough evidence, we've done enough research, we need to start acting. So come with me to this really interesting conversation next week with Colin Lowe, Director of the Design Aging Institute. I know that you'll be just mesmerized as Bruna and I were today. So, Ayuk, before you have your takeaway messages, I want to thank you. Thank you for representing so well the inspiration, the vision, and the very essence of Dr. Hisashi Hazumi. You know, Greg and I have the great pleasure of knowing you and Dr. Hazumi as friends and family. Family first and then friends, I think. And so really just, I have been able to be transported back in time, you know, to look at these images and know the value of the work that you both do, but also the inspiration of Dr. Hazumi. So, Ayuk, please take us out with your key takeaway messages.
Okay. Thank you so much, Jane, and thanks to the staff. Thank you, Greg, and thank you to the IFA, and thank you to all who joined this session today. I'm a little bit short of what to say in appreciation for being part of this very important event. And well, my takeaway message will be that art in healthcare is important and is becoming a subject of conversation, especially among service providers. And the goals of With You Group Art in Healthcare are, first of all, to beautify the facility. Art should not only be a tasteful decoration, but should be symbolic of what can help heal a person mentally and physically. You're going into a hospital, a clinic, or a facility, you want to be comfortable, you don't want to feel any pressure, you don't want to feel like you're in a place of people who are depressed or people who are going to die. You want to see something that will take your mind and give you a perspective of tomorrow is going to be a good day kind of feeling. And then we can also think of how it creates venue for cultural and art activities. Some of the projects involve bringing in school kids to these facilities to work and play with residents. And it's just a wonderful, wonderful scene whenever this happens. So I'm saying that, well, art is very useful in a healthcare environment, but it is not that simple to make a complex institution out of an elderly care facility or a hospital. But we can tear down the walls that separate, you know, the possibility or opportunity that a patient or a resident can have to express his or herself. And that, I believe, is one of the ways that we do respect the rights of people in a hospital, the rights of residents in a facility.
Thank you very much, Ayuk Christian from city of Akita in Japan. We wish you all a safe and happy week, and we look forward to being back with you for the Global Cafe. Special mention to Bruna Swerts and to Luana and the IFA team. Thank you very much, and we'll see you all next week.